is an amazing machine. Now that's the QL, okay? It attaches to the bottom ribs, your spine and your hip. This is a front view, okay? So this is basically, if I were to take a picture through me, the QL is here. There's my spine, there are my ribs. It goes from here all the way down to here, okay? So we're gonna be working with that one. And this is the magical psoas, okay? Which attaches from the front, okay? So if you envision the QL is behind, the psoas attaches from there and goes all the way down to your hip bone on the inside, okay? So if you are having pain possibly here, if you are having pain here, if you are having pain in here, if you are having pain here, so basically just underneath the ribs, then to show the back of me. Ideally, you do this in bed because it's a nice, comfortable place. It's safe. You can breathe, you can relax, okay? I recommend that you get more than one pillow. So you have one pillow for your legs and you have one pillow for your head, okay? Or if you want more for your legs, that's fine too. So if I lie here, I wonder if you can see me properly. Okay, so my spine is here. This is my hip bone. If I were, this is my sacrum. It's a little triangle bone, okay, that attaches to my hips. Now, I want to massage this and all of this, okay? I start off finding my lower ribs, okay? And I find my thumb inside that little triangle. So if I were to find the spine here and my lower rib, and I'm basically going to put my thumb right in the lower base of that rib. Now, actually, if you put a pillow underneath you, then your spine will stay level and your hips will stay level. So I want you to have your thumb in here and you're going to find a trigger point. Some of you might just putting your thumb there will be enough. It will be painful enough. So don't shove it in, okay? I want you to think of pizza dough. If you shove things in, if you're pulling pizza dough apart, it's gonna break. So I want you to be very gentle and work with your thumb along the spine. So it's a very gentle movement just along the spine. It's as if I'm leaving fingerprints on my pizza dough. Okay? That's the beginning of my hip bone. So then I come back up. And then I'm going to work around my rib. All the way around. Now for me, and for many, this area here can be quite painful. So if you find a trigger point, I need you to think of a pain line, 0 to 10, 10 being very uncomfortable. I don't want you to get to 10. I want you to stay at a 4, 5, maybe 6. 10 means that you're holding your breath or you're really tightening up, okay? So I need you to be able to breathe through it. So you're going to press, you're going to hold until that 4, 5, maybe 6 changes. The change might be, it goes up, it may go down, it might become hotter. Whatever the change is, it doesn't really matter, it's a change. And then you move and you find another one. Now that area where the rib and the spine is kind of imagine it like a 90-degree angle. That whole area It's kind of a diamond shape. Can be excruciating on some people, especially if your muscle is in spasm. So be very, very gentle, okay? If you feel, actually, that feels really nice and I want to work a little bit harder, then what I want you to do is you're going to be holding it and you're going to be moving your leg like so, okay? So if I show you, you're basically doing that, okay? But if it is excruciating, then all I want you to do is just hold it and breathe, relax into it. Remember, the diaphragm is attached to the psoas, which is attached to the QL. So the more you breathe and you relax into it, the more breath and movement you're going to allow to the area. And that will basically start with the opening up that I keep going on about, okay? So let's go back to the position. Okay. I'm here. I'm working. Now, when I work, if you think of your waist, I want you to be working downwards, okay, and round. So if I were to find that area that's hard, okay, so right there, you'll feel it. You'll feel that you've got your spine and there's a little bit more kind of structure before you get to the kind of waist area, okay? So work downwards. And again, if you find an area that's uncomfortable, you can either do it with your thumb or you can do it with your fingers. Gently press down. And if you can, then move that leg. Beautiful. Now keep going down. Okay. And now we're in the hip area, okay? So think of the sacrum, think of the spine. Again, there's a 90-degree kind of angle. It's not quite 90 degrees, but I like to think about it as a 90-degree angle. You're going to place your thumb there. And just imagine that you want to leave a nice imprint in your finger dough, in your pizza dough. So I want you to be working upwards, following the hip bone. So the hip bone, you have the ulna, which is there. You're working just underneath and you're working upwards. Okay, and then you're going to be working downwards. So if I look at my my hip and my waist, you can use both your thumbs or you can use one hand, and you're basically going to be trying to work the ridge around gently. So you're going to move your leg. Okay, fantastic. Now, I want you to stretch that area out. There are various exercises that you can do to stretch. Remove the pillow from your head and you're basically going to roll and then roll back. Roll and roll back. I want you to curve and uncurve, curve and uncurve, or you can do it on all fours. Again, mobility, it's really important. So you're going to go on all fours. Make sure that your shoulders are in line with your hands, your knees are in line with your hips, and you curve up. You let go of your spine, let go of your head. Breathe in as you come up. So you're really thinking of a 3D breath. You're really thinking of opening up the ribs as you breathe in and exhaling, shrinking those ribs in. So you're doing this. Remember, our lungs open up at the front as well as at the back, okay? So it's this motion, in theory, it's actually this motion that you should be thinking, okay? So we're going to curve a few times, and then I want you to curve. Imagine that you have, I know it sounds a bit naughty, but imagine that you have two pencils on each, a pencil on each butt cheek, and you're doing a circle, okay? So I want you to do a circle literally with just your bum, okay? And then do a circle the other way. And if it feels nice, then just slow it down and move your body in different directions. There's no right or wrong. If it feels nice, do it, yeah? So different directions, circular motion, up or down, okay? And then lastly, a lovely stretch for the QL and the psoas, if you're able to, because some people have knee or ankle problems. You sit on the side. I call this the mermaid stretch because I envision a beautiful mermaid on a rock brushing her hair. I know, it's a bit weird. Anyway, grab your ankle. You're going to come up and over. Now, this is not just this. This is up and over. So I want you to think of a fan that you're opening up here. So you go. Now, as I'm reaching up, I'm sending my elbow to the ceiling, but I'm also thinking, putting intention on my hip bone, going down into the floor. So I'm really opening. So I'm going to breathe and exhale. Inhale and exhale. Beautiful. And then do the other side. Inhale, exhale. Inhale, exhale. And then release. Yeah? So really think, opening up, this is reaching up and over, and the hips are going down, okay? It's great if you could do those stretches after you've done the massage. If you think, actually, I'm just going to bed and I just want to have a little bit of a rub, then just do that and do the stretches in the morning. Another great thing to do is after you've done that, grab a hot water bottle, or if you are fortunate enough to have an electric blanket, use an electric blanket and just put it round. Just, love yourself a little bit. We're under really stressful times and it's difficult. So try that. I hope that helps. And I will continue sending more. Hopefully that will help. Bye.